I've been at the University of Florida and UF Health for over 30 years. As a patient, I could make a call, get an appointment for anything that I ever needed. I never had to leave my city. It was a huge shock when I moved to Kanab because so many rural communities here in Utah have no resources.
I'm from rural Utah. I grew up in Tropic. We didn't have access to healthcare locally. We had a clinic that was open a couple hours twice a week, or otherwise we had to drive 30 minutes to get just a primary care appointment. And any specialty care was 2.5, 3 hour minimum drive. And coming from rural, I have a little bit of the underdog syndrome. We're not used to getting resources, we're not used to getting attention, so you fight for everything that you have.
We have a lot of patients that have to go to St. George 3 times a week to sit in a chair for 4 hours for dialysis.
Here in a rural community, I'm the only dietitian from here to St. George, and so I see pediatric patients, I work with people with chronic kidney failure and diabetes and gut issues, and so I kind of have to be a jack of all trades.
IT in a rural setting is unique because we have to deal with challenges that you don't see in a big city. We don't have internet redundancy because we have one internet service provider. I'm trying to staff 2 positions, and it can be difficult to find those with tech knowledge.
One of the phrases I hear a lot is, well, this is how we've always done it. But things are changing and evolving in healthcare and technology so quickly that the way we've always done it doesn't work anymore. Utah will get just south of $1 billion over 5 years. It's a really unique chance to take a look at how we do things and try to overcome some of the barriers rural healthcare has had in America that we just haven't been able to get through because there hasn't been a sufficient funding source or sufficient effort at a large scale to get through those barriers.
They cut the number of people that were on the Medicaid rolls. What that means is that there will be fewer people on Medicaid. We will receive fewer Medicaid dollars, and those individuals that were on Medicaid that are now not on Medicaid become self-pay. Self-pay in healthcare often means no pay. As a small organization, I don't have the manpower or the staff to fight against the big insurance.
I still get stuck in my paper ways sometimes. I know that I'm doing things that take me 2 or 3 times longer than they should because it's how I know how to do them. It's not because there's not a better way, it's how I know how to do them. The entire purpose of the conference is meant to convene rural healthcare and technology to foster a shared vision of how to move forward together so that we can maximize the technologies available to make rural healthcare as efficient and as effective as possible in Utah.
What we wanted to do was just sponsor an event where it's all about RHAU and the people and the agenda that they want to put together.
The thing that I think is different about this conference is it's just knowledge. It's like, this will do well for you, this will do well for you. You go find a vendor that will do these, but this is how you find the right vendor. I think that's important, is that we have an unbiased platform.
It's going to be a very exciting opportunity for us to get together and hear from each other and from industry experts. We may be thinking, oh, I'm the only one facing this problem, but chances are we're not.
If you come to this event, it's going to help you learn how to do things in new ways that are going to make things super efficient, much faster for you. And if you may not know what you don't know, you may miss huge opportunities that would make a significant difference in your facility. So you don't want to miss this because you don't want to miss out on this information, on this discussion, and get left out while everybody else moves forward without you. This conference really is for everybody. We need all of those voices in the room from every area in healthcare and technology in order to create a true shared vision that meets everybody's needs.